Hi, I am recording this ANCC Psychiatric Mental Health Nurse Practitioner preparation material for a couple reasons. One is I'm reviewing it for myself and during the pandemic, and two, I want to support others in um, learning this material. So this is just a little bit of the exam. There is another video that I did with the outline on um, how I studied for 2 weeks and passed the exam. Okay, so this um, presentation will cover competency, standards, regulatory issues, ethics, telemedicine, and special populations. Um, so first we'll start with core competencies, which are based in scientific foundations, leadership, which has to do with participating in community-focused programs, advocacy for complex patient and family rights and issues, and interpersonal professional collaboration. There's also quality competencies, evaluate such as using the appropriate use of restraints and care, um, technology and information literacy, policy, which influences health policy to reduce stigma on mental health services and treatments. There's a few more competencies. They're not all listed here. I listed the primary ones. All of these topics that I'm covering, there will be questions from each one of these. Each one of these slides will be covered in the exam. So the next one is independent practice competencies, which has to do with developing age-appropriate treatment plans, differential diagnosis, evidence-based treatment, including psychodynamics, cognitive behavior therapies, and other psychotherapies, integrate recovery-based principles, treat acute and chronic mental health disorders, safely prescribe psychopharmacology and non-psychopharmacologic interventions, educating the patient and their family regarding the benefits of treatment. Some other ones include using individualized outcome measures to evaluate the care, manage psychiatric emergencies, refer clients to primary care or other professional providers as well. Like, for example, if the person has develops an increased vulnerability to diabetes, then you have to refer for that. Maintain therapeutic relationships over time with patient families and groups. Therapeutically terminate the patient-nurse practitioner relationship. Be able to address sexual and physical abuse, substance abuse, sexual and spiritual conflicts, document appropriate use of seclusion restraints, treatment, etc. Document, right? Okay, regulatory and statutory roles. State legislatures grant the legal authority for the nurse practitioners to practice in each state. So they're all a little bit different. States provide title protection, define advanced practice, scope of practice, and restrictions. Grounds for disciplinary action include practicing without a valid license, falsification of records, Medicare fraud, failure to use appropriate nursing judgment, failure to follow acceptable professional standards, and failure to complete accurate documentation. So there are a few more of these, and hopefully we'll be covering some of them. Statutory law regards rules and regulations, which, as I said earlier, are specific to each state, and they may further define the scope of practice. They can also include limitations. For example, I believe in North Carolina, you have to work under a physician. Licensure is a process, but this is one that you will definitely see in there, a process by which a governmental agency grants permission in exchange to engage in a profession. So this is by the licensure is by a governmental agency, and accreditation is by a private agency, such as Ancc. It also prohibits, license also prohibits others from legally doing protected practice. So credentialing, the process used to protect the public by ensuring a minimum level of competency. And certification is a credential that provides title protection, determines the scope of practice, the process by which a professional organization certifies that person licensed as a professional has met predetermined standards specific by that profession for specialty practice, and assures the public that the person has mastery over a specific body of knowledge, and assures that the person has acquired skills needed to function in a specific role. And here's some topics under scope of practice. I do want to say that most of this information comes from the Psychiatric Mental Health Nurse Practitioner 4th edition by the American Nurses Association, otherwise known as the Purple Book, which I highly recommend that you purchase. The scope of practice is some of this will be in the what I call the Green Book, which is Standards and Scope of Practice, and that's also by the ANA. My school used both of these books extensively. I recommend that I did not read the Green Book page by page, but because we had used it so much, I just kind of paged through every page, and there was a couple things that I hadn't looked at while I was in school that were helpful. So I'm not going to read this one. You've probably had time to read that. The main thing is that it does vary from state to state. And okay, and here's the standards of practice. And again, I don't believe this is all of them, but just the ones that I thought were important. Again, this is high yield. Standards of practice, authoritative statements regarding quality and type of practice that should be provided. And it also provides a way to judge the nature of the care that you've provided, reflects the expectation for care, reflects professional agreement focused on the minimum level of acceptable performance, and it's also used in a court of law to legally describe the standards of care, and there may be some precise protocols that must be followed. This is on telehealth. I work in addiction medicine, and in 1 week we got everybody over to telehealth. This is using a phone or video conferencing to deliver health care. It's influenced by the same standards of care and practice as you would in a clinic. It's practiced in compliance with international, federal, and state regulatory agency standards. Telemedicine must include provisions for emergency care of the patient, and it's also got to be HIPAA compliant regarding confidentiality and documentation. This I pulled off the internet. OCR has provided clarification of the good faith and bad faith provision of telehealth services. Aside from criminal use of PHI and further use of PHI outside of the provision of telehealth services, OCR warns that bad faith includes any violation of state laws or ethical standards that would normally result in disciplinary action, and the use of public-facing remote communication solutions such as, it says Twitch, I think that should be Twitter, Facebook Live, Slack, and chat rooms. The only non-public facing platforms, must be used, which can include Apple FaceTime, Google Hangouts, videos, WhatsApp chat, or Skype. There are a bunch of other venues out there that are more HIPAA compliant, but at this time with the pandemic going on, they've relaxed some of this, as long as there's good faith. Okay, elements of informed consent include the nature and purpose of proposed treatment or procedure, the risks or discomfort and benefits of treatment versus no treatment, alternative procedures or treatment, the diagnosis and prognosis. Under ethics, I just wrote down some basic terms for justice, beneficence, non-malfeasance, fidelity, autonomy, veracity, respect, and some of them I promise will be on the exam. Cultural competence has to do with treating patients from diverse cultures, viewing them as unique, and noting a potential relationship between one's cultural experience and their symptoms and perceptions, including our own as well as the patient's. The more a nurse practitioner is sensitive to cultural influence, the better she can treat the patients. Culture includes learned beliefs and behaviors, or the socially inherited traits among members of groups, may be racial, social, ethnic, or religious grouping. Cultural bound syndromes specific to a person's culture and not linked to a psychiatric disorder. Okay, and so now we're going to get into some special populations. I'll talk about homelessness first. As psychiatric nurse practitioners, we've got to be sensitive to the challenges faced by homeless individuals and possess appropriate communication skills to communicate with these people. A majority of homeless families are headed by a single parent, usually a woman, and teen mothers are at risk due to limited education and job training. Reasons for homelessness include mental illness, addictions, poverty, unemployment, inadequate public assistance, domestic violence, and lifestyle choice. So 50% of homeless individuals have co-occurring substance use disorder and serious mental illnesses. I'm sure that's even higher than that. And schizophrenia accounts for anywhere from 15 to 45% of U.S. homeless population. Mental health symptoms are often active and untreated, which make it difficult to get a job and maintain a job, relationships, and other meaningful activities. Homeless individuals with co-occurring disorders are at risk of violence, medication non-compliance, and treatment resistance. Okay, I've listed some strategies for reducing homelessness. There's several questions on homeless population. So outreach, integrative care, supporting services, and prevention. Migrant and seasonal farm workers, another topic that is included in the exam. I just want to say here that migrant persons are people who leave their permanent place of residence to work in agricultural jobs in different locations. And seasonal workers travel from their permanent residence seasonally for agricultural jobs. Now this information is a little bit old, but there's greater than 3 million migrant and seasonal workers. I don't know if that's still true. But if this says it, this is what is being used on the exam. Working conditions are difficult. They may not speak the language. There could be isolated, living in less than substantial housing, discrimination, and limited health care. They have an elevated incidence of depression, anxiety, and substance abuse. And physical and emotional abuse, especially towards women, can be challenging to track and treat because of their migratory nature. Sexual orientation, as medical professionals, we need to be open, supportive, and sensitive, possess a sensitive attitude towards individuals of various sexual orientations. Sexual identity, is defined as how people identify psychologically on a continuum between male and female and to whom they are sexually attracted. Gender identity is also along a continuum between normative constructs of masculinity and femininity. And influences of gender identity they can be biological, pre- and postnatal hormonal levels and genetic expression, or there could be influenced by social factors such as gender messages from family, media, and the culture. Here's some information on sexual orientation. If you've made it through this far in the course, hopefully you're aware of these various sexual orientations here. I'll have you review that on your own. Okay, so now I can see this. Forensic nurse-client relationship is based on a crime committed and investigational aspect. And let's see, correctional nurse-client relationship is based on offender's current mental health and medical condition. So forensic is there could be a child involved, and level of competency. Can you take care of your children? Can you take care of yourself? Forensic knowledge base relies on evidence-based practice as well as past clinical experience. It incorporates both the criminal justice and mental health systems. And then I've got something else there, which unfortunately, it's a little, if you are going to go into forensics, you do need some special training. So that's all that I've got for today. Check back. I'm going to be here for a while with the pandemic going on, and I will have more. Thanks. Good luck.